Very good evening and thank you everybody. Today we are going to discuss in this virtual platform a very burning issue of the day on COVID vaccination. The vaccination process has started already throughout the country. Many questions are arising in the minds of the people in general, including the minds of our medical fraternity. Today we will discuss the same with our esteemed panelists on the subject in the question form put to them and the answers from them. So straight away I'm going to the questions. The first question would be our panelist, Dr. Susmita Chowdhury. I believe the introduction have been given about our panelist. Susmita Chowdhury, Arup Halder, and Indranil Halder. The first question to Dr. Susmita Chowdhury is, what is COVID vaccination and what is the need of this vaccination?
Good evening, Drupada. Thank
Yes.
you for asking me to be a panelist here. So yeah, absolutely. The most common question people ask is, what is vaccination and why is it important? And what we have realized is that it's a very, very critical tool in our battle in this pandemic at the moment. Just to keep it very simple, vaccines work by training and preparing the body immune system to recognize and fight off virus and bacteria that they target, so that whenever the body is exposed to the pathogen again, the body's memory cells are immediately ready to destroy them by recognizing their presence, thereby preventing illness. And that is what the COVID vaccine does as well, where parts of the virus which are dead or which have been used in such a way that it doesn't cause illness to the body, but prepares the body to fight it if it should be presented with the COVID virus. That's what it is all about.
Thank you. Thank you. My next question to Dr. Arup Halder. Who are the candidates for this vaccination, of this COVID vaccination? Arup.
So thank you, sir, at the outset for inviting me in this panel discussion. So who are the candidates for COVID vaccination? Actually, this vaccination policy is different for different countries. At present, we in our country have a target to vaccinate 30 crore people who are the priority group. The first priority group was a healthcare worker, and it is around 2 crores, I think. And the second priority group was the frontline workers, like the police, central and state police, or the armed forces, or the members of the disaster management group. And together they form total 3 crores. And apart from that, we have 27 crores of people who are having an age of more than 60 years. And those people are less than 60 years or more than 45 years having some comorbidity. So the main aim of this vaccination is to first reduce the mortality of COVID-19. And the mortality is very high in this age group, in the elderly people more than 60 years and patients having a comorbidity. So this age group has been targeted because in our country, those patients having more than 50 years of age has 78% of the comorbidity. So the first priority will be this group, and after that, when the vaccination is complete in this group, I think it will be percolated to the general population to build the herd immunity. So the first priority is to reduce the mortality, and the second priority is to build the herd immunity at present, because the vaccine demand and supply mismatch is there. So we do not have that much vaccine to vaccinate all the people in our country in 1 or 2 months. So this is how the vaccination is done in our country.
Okay, thank you. So you are prioritizing with the vaccination, and that should be done, definitely. Now, my next question is to Dr. Indranil Halder, or the third panelist. What are the contraindications of this vaccination? Indranil.
So thank you. In the onset, I should thank the Indian Chess Society, and again, thanks to our President-elect, Dr. DJ Rai, who has taken the initiative and whose brainchild was this program to percolate this in every parts of this state or the region, so that we can have an idea of what is going on in vaccination, because a lot of questions are coming up in this vaccination issue. So when it comes to contraindication, see, First, I'll tell that pregnant and lactating women has not been a part of the COVID vaccine clinical trial. Therefore, the women who are pregnant or who contemplate to be pregnant in the near and lactating women should not receive the COVID vaccination. Again, in terms of contraindication, the vaccine is contraindicated for persons with history of anaphylaxis or allergic to previous dose of any COVID vaccination, immediately or delayed allergic reactions to vaccines or injectable therapies, pharmacological products, food items among them. See, again, there are some contraindications also because, for example, for persons who have active symptoms of COVID, SARS-CoV-2, these patients who have given anti-COVID-2 monoclonal antibodies or convalescent plasma, or acutely unwell and hospitalized patients who are ill, at least the vaccine should be deferred to about, say, 8 weeks after their recovery. See, in fact, there are some relative contraindication, but again, this should not be an absolute contraindication. For example, if there is a bleeding disorder, coagulation disorder, this should be observed. And in fact, another important thing which people do ask is the allergy. For vaccines in persons with a history of allergic to some other, say, example, food, oral medication, latex, pets, insects, triggers, they can be vaccinated. Only thing is that they should be observed for a more longer period of time. So these kind of allergies, asthma or any other allergic disorders are not contraindicated. And so in fact, that is the most important thing. Well taken. That these people are not contraindicated for vaccination. Only their observation period after the vaccination should be prolonged.
So in general, the pregnancy, lactating mother, and the history of anaphylaxis, these are the main three areas where
absolutely. So again,
Sir, I want to add a little bit here. Actually, pregnancy and lactation is not an absolute contraindication, as has been told by various bodies. So we can discuss these things along with the mothers, the childbearing mother, because it has been seen that COVID can cause a preterm birth or more ICU admission in the mother. So if she agrees, we can give it, but this is not an absolute contraindication. So, this is a mere relative contraindication.
So absolutely true, Arup. That is what I told in my first line, that since they were not in the trial, we cannot comment.
Let me clarify what basically all of us mean is that because they were not included in the trial, therefore they are not included in the program. However, in many countries, it is offered to them if they willingly want to take it. Because what is a long-term effect, etc., nobody really knows. But having disease from COVID during pregnancy compared to the vaccine itself, the disease is much worse. So it is offered in many countries, and we can discuss it with them. It's not included at the moment in the comorbidity list. That's it.
Only one thing I'll be adding just to support Arup. See, the mRNA vaccine, in fact, if it is given to lactating women, in fact, some of the antibodies are transmitted from the to the milk to the baby. And in fact, in that way, the babies are also protected. So that is a theoretical advantage. But for epidemiological aspect, Arup, you cannot recommend that this vaccine can be given because we don't have any studies for that.
No, it can be recommended with discussion to the mother, actually.
Absolutely. Definitely. The next question goes to Arup again. What is the mode of action of this vaccination? In brief. Definitely.
Yes, so there are different vaccines. So mostly the vaccines are made as a plug and play mode. These are manufactured in plug and play mode. That means there are different platforms. First, the antigen, which has to be delivered with the vaccine, that is identified. Then the nucleotide sequence is made for that antigen, and it has been plugged into some vectors, like it may be a lipid nanoparticle, or it may be a viral vector, or it may be something else. So depending on that, there are various platforms of the vaccine. It may be an mRNA or DNA vaccine, it may be a viral vector vaccine, it may be a protein subunit vaccine, and there are a lot of things. So most of these vaccines actually target the spike protein of the virus, and the spike proteins are taken up by the cells, and they are degraded and presented to the MHC class 2 or MHC class 1 molecules expressed in the cell surface, and that causes an antibody production against them. there is both a humoral immunity and cellular immunity development against this antigen, and that's how it's worked in most of the people. So it's basically identifying an antigen, putting the antigen in a carrier, and just introduction into the cell and inciting the immune response. This is just all the vaccine do in our body.
So well understood. In fact, now the question goes to Susmita. Now, what is the dose and schedule of the vaccination? There is a schedule that should be followed. What is that? And you please explain that also.
So I think we are doing a very good job in our country by creating the portal where, even lay people will not be able to forget when to take it. So presently in our country, the dosing is 0.3 mils, 2 doses, which have to be taken. For the Covishield vaccine, the dosaging is 4 to 6 weeks apart. And for the Covaxin, it is 28 days apart, 2 doses of the vaccine only, which is given intramuscularly.
Right. So it should be at least 4 weeks, not before, and for 4 to 6 weeks. Okay. Next question goes to Indranil. What should be the interval between the first and second dose of vaccine? But I've told already.
So yes, it has already been discussed by Susmita. So if we just extract what the expert panel on the WHO has suggested, it was 8 to 12 weeks interval between the 2 doses of the COVID vaccines. So it is because the efficacy and immunogenicity increases with a longer interval, this interdose interval. So 8 to 12 weeks is recommended. Next, again, they have also gone further that if inadvertently it is taken before 4 weeks, you need not repeat it. And if it is not taken after 6 weeks, give it at the earliest interval. But if someone defers it even after 12 weeks, there is no need to give another booster dose. So the best is 8 to 12 weeks, not before 4 weeks, and not try to avoid after 12 weeks. That's the only thing.
So the protocol here is being maintained at 4 weeks. So it should be as late as possible, close to 6 weeks at least.
Practically the purpose, what I think was, it's an epidemiological aspect that has been taken into account, not before 4 weeks, and they have kept it 4 weeks because by that time people will be knowing it and they will be taking it. But the WHO expert panel, or if we see that the AstraZeneca or the University of Oxford vaccine that they have done, they have made and clearly seen that the most efficacy is when it is given at this 8 to 12 weeks interval.
That's true. That's true. In fact,
so this is for only the Oxford vaccine or that's Covishield vaccine. For Covaxin, we do not have any confusion. It is always after 4 weeks, and there is no other recommendation.
Yes.
There? Yeah.
This is what I told is about the AstraZeneca, the Oxford vaccine.
The question again to Susmita. How are the two vaccines working, Covishield and Covaxin? Is there any difference between the two? And what are the difference? In brief.
Yeah, so I think it goes back to what Arup just said. The two are different ways of sending in the spike protein into the system. So the first one, let's talk about the AstraZeneca or Covishield one that first came in. So it's basically based on the viral vector platform, where a very weak chimpanzee adenovirus called ChAdOx1, it carries the coronavirus spike protein into the human cells, which then increases the memory B cells, T cells to produce antibodies against COVID, so that when infected, it works like that. Whereas Covaxin is basically the whole inactivated virus which is sent into the cells, and that is how it produces antibody production into the body. So that's basically the mechanism. The two are different in that way. The second one is that with the Covaxin, it is in India, it is recommended in children above 12 and above, whereas Covishield has been recommended in children of 18 and above. So it's basically for adults, but Covaxin can be given in 12 and above.
Right. And the next question goes to Arup. Arup, are you?
Yes. Yeah. I'm here.
Question goes to Arup. That apart from this Covaxin and Covishield, there are other vaccines in the pipeline. And what are the other different vaccines?
So in India, we have many different vaccines in the pipeline, and possibly by the end of 2021, we'll have a whole lot of vaccines, 9 to 10 vaccines we'll have available for mass vaccination. So two vaccines we know that already been discussed. One is Covishield or Oxford vaccine. Another is Covaxin or our inactivated skilled virus vaccine by Biotech. The next vaccine which is going to come, the next vaccines which are already there, but in the trial mode, one is a Sputnik vaccine by the Gamaleya Institute, the Russian vaccine. And another is the J&J vaccine, the Johnson & Johnson vaccine by the Janssen, that is going to come with the biological E company, and they're launching this very soon, and the trial will be very soon in our country. We do not have any trial for the Moderna or Pfizer in our country, but Pfizer actually applied for a trial, then withdrawn their approval. We don't know what is the reason. Moderna going to come possibly with Tata Healthcare. They are collaborating with that. Apart from that, Zydus Cadila vaccine or ZyCoV-D is a DNA plasmid DNA mediated vaccine, which is in the phase 3 trial, and possibly next 1 or 2 months we are going to get this vaccine. And another vaccine is that biological E vaccine, which is apart from the Johnson & Johnson, they are also developing a spike protein vaccine by themselves. Another vaccine is that Genova vaccine, which is an RNA vaccine, which is developed by the Serum Institute, apart from this Oxford vaccine. So there are a lot of vaccines in the pipeline, and there are many in the phase 1 and phase 2 trial, few are in the phase 3 trial, and we're going to have a lot of vaccine in near future in our country. All are indigenous.
Just to ask you about the Pfizer mRNA vaccine, is there something like the vaccine that is also manufactured in India right now? Do you have
yes,
any?
mRNA vaccine is a Genova vaccine that is
Yes.
that is being developed by the Serum Institute of Pune, who has developed the Oxford vaccine. They are also doing a research on this mRNA vaccine.
Similar to the Pfizer vaccine.
Similar to the Pfizer vaccine, but more stable, I think, more stable in our temperature.
Temperature, yes. The temperature by the
Yes.
Pfizer vaccine states about -70 or something
Yes.
like that. Their vaccine, they are claiming that it is more stable in the tropical part of this country.
Yes.
So Arup, thank you for giving an overview of the different vaccines that are in the pipeline. Some are being manufactured also in India, and those are going to come in the future. Next question goes to Indranil. That what is the safety of this Covishield vaccine?
So, yes. So Covishield has been in controversy right now in some parts, and so let me just clearly. So studies that was published in Lancet, just to go back, at the preliminary study, showed that the vaccine has a good safety profile with serious adverse effect events and adverse in a balanced across the study. So there was very less serious adverse effect. Only those serious adverse events that was reported and that was published are a case of hemolytic anemia and a case of transverse myelitis 12 to 14 days after the vaccine. These are some of the studies that was published during the ongoing trial. But some of the reports of blood clot in some people who received this AstraZeneca Oxford vaccine has led several countries, mostly from Europe, to temporarily stop using the vaccine. But the World Health Organization has said that there is no link between this vaccine and the increased risk of developing blood clot, because in fact, this risk of blood clot is there in general population, only in the adults. So whether it is related to the vaccine or it is as such a normal phenomena that has occurred is not sure about it. But only thing is that till now, the vaccine is safe. And if you see that there are very common side effects of the vaccine, which include tenderness, pain, generalized unwell for 1 or 2 days, feeling tired, fatigue, chills, headaches, or nausea, joint pains. This is something which usually occur with any vaccination, and these are something which is also there with this Covishield vaccine.
So, Indranil, yes, rightly said. Actually, there is always a background prevalence of these clotting disorders in the general community, and it has been seen for 10 million population, for 10 lakh population, there is 120 incidence of blood clots or thromboembolism in our general population. And they have compared it, what is the general incidence and what is the prevalence in the vaccine induced in the vaccinated people. And this is much less in the vaccinated people actually.
That's
so
the reason. That's the reason.
Yes,
Arup, absolutely true. I'm not going to the statistics what they have given.
Actually, if you talk about numbers, it's 1 to 2 per 1,000 as per US data. In normal population having DVT or pulmonary embolism, here it was only 35 and 17 million people.
Yes.
So that is way lesser. So So, and whether
So-
this is coincidental or not, it is not
Absolutely.
known. So,
So let us talk the bottom line. Let us talk the bottom line. It is safe, except
Yes.
some of the general reaction that we see in vaccination. It is safe. The bottom line is it is safe. And why should countries stop the
that is the
vaccination?
message. Right.
Why
The message is,
countries stop the vaccine? It is up to them. But the WHO is clear and explicit about it that there is no such much increased risk.
Yes, most of the vaccines are safe and much safer than COVID-19 itself.
Absolutely.
now the question, we have talked about the safety of Covishield vaccine. Now, efficacy of this Covishield and Covaxin and how an efficacy is judged. And this question goes to Arup.
Yes, sir. I will take some time to explain this. Actually, these efficacies are numbers, and this has been highlighted many times in the media to show the superiority of one vaccine against the other. But this efficacy is a very vague term. Actually, this is the efficacy means it is efficacy is judged only for the trial population. Actually, it is not equal to effectiveness. Efficacy and effectiveness are two different words, actually. So if the vaccine is 95% efficacy, if it's told like that, that means in that trial, in that population, and for that time, 1 or 2 month trial period, it has shown an efficacy of 95% for those people. But it is not a real world phenomenon. In the real world, the efficacy might be much less, and that is called the effectiveness. And efficacy is judged differently by different vaccines. Like Pfizer and Moderna, what they have done, they have judged efficacy they have actually divided those patients into people into two groups. One group received vaccine and another group received the placebo. Suppose for the Pfizer group, 22,000 received the vaccine and 22,000 received the placebo. And they have checked the relative risk reduction. It was 95% for them. And how they have judged this? They have followed up this patient. Those who developed symptoms, actually for them, they have done the SARS-CoV-2 RT-PCR. But how AstraZeneca checked this? AstraZeneca has checked this by doing RT-PCR to every patient, irrespective of symptoms. We know that SARS-CoV-2 does not always produce symptoms. 80% are asymptomatic. That's why I think AstraZeneca has a lower efficacy, because they have used more stringent protocol to define efficacy than the Pfizer or Moderna vaccine. So this efficacy is a very vague term. It is not equal to effectiveness, and we should not judge a vaccine by its efficacy, actually. This is just a number.
So another way that they do is usually finding out the antibody titer, how soon or how effective the antibody titer is reached in that vaccine. But in these two vaccinations, they have not done it that way. That's the real picture that has been done.
Should it be recommended that antibody titer should be checked randomly in patients being vaccinated to see the actual efficacy in the practical field? This is a question to Indranil. I'm just asking.
No. See, I don't think that it is really justified or epidemiologically it is feasible to check the antibody titer. Theoretically, yes, because when we are doing trials, or at least in the phase 4 trial, we may be asking to see the antibody development or the titer that has been rising or not, whether the titer has reached the level as per the guidelines or not. But epidemiologically, when you are giving the vaccination a mask, it is not possible to see the titer.
The other thing is that in many people who have recovered from COVID, you find some of them do not mount an antibody response.
Absolutely.
Yes.
That does not mean that they don't have any further protection or immunity for, say, 2 months, 3 months, whatever post-COVID. Because more than that, there are other methods of immunity that COVID deals with.
Yes.
Right.
And that can be also true for the vaccinated people if you go
That's
for
right.
antibody titer only.
That's right.
The next question to Susmita again. Based on trial data, what are the differences between these vaccines?
I think I have answered it in my previous question. Both of them are not really very different apart from the type of vaccine vector that they are. One is an inactivated one, which is Covaxin, and the other one is a viral vector vaccine, which takes chimpanzee adenovirus ChAd-OX1 with the spike protein. Both need to be stored at 2 to 8 degrees Celsius, and the kind of efficacy that we've talked about is nearly about 60 to 70%. One says it's 81 in Covaxin after the second dose, and in Covishield it's been seen after 2 doses it's 62. But on an average, 60 to 70% efficacy is what is being put forward. So both are not very different apart from the type of vaccines that they are.
Right. Now the next question goes to Indranil. What should be the follow-up of patients taking Covaxin?
Yes, that's an important thing. So follow-up means
Very
immediate
practical
follow-up
thing.
and long-term follow-up also. So see, if you see general hypersensitivity and anaphylaxis, as with all injectable vaccine, be it even measles vaccine or any other the chickenpox vaccine that we give, as appropriate medical treatment and supervision should be readily available in case of an anaphylactic event following the administration of the vaccine. So vaccine recipients should be kept under observation for at least 15 minutes. And as I told in my previous, that at least 30 minutes for people who gives a history of at least allergic symptoms, allergic reaction to any other, say food or latex or something like that. So next thing is that as with any vaccine, vaccination with the two vaccine, you tell Covishield or Covaxin, does not protect all vaccine recipient. So individual may be optimally protected after receiving the second dose of the vaccine, but still they have to use their other means of protecting from COVID, like the mask, the
Okay, we'll come to this issue after that.
So, and another thing is that some of the people ask, this is something which people ask, and that's the practical issue I'm telling you, whether they can drive home after taking the vaccination. So I've gone through the literature because this is the question that many people have asked me. I've gone through literature and they told that there is no reason that you should restrict people from driving home after taking the vaccine. So there is no possibility of any other risk, driving machinery or driving. So you can drive after 30 minutes of waiting period.
Okay. Next question to Arup is this: how long are these vaccines going to protect the illness?
Oh, that is a $1 million question.
Answer question, and asked by everybody. And
answer is still not known actually. So in general, it has been seen that if you have a natural infection, you are going to be protected for at least 3 months, and then now studies coming, you are protected for at least 8 months. And with the time, actually, the duration will probably increase. And for vaccination also, we can say similar things because it is almost similar with some difference. So at least you are protected for 6 to 8 months, we can say. But now if there is a variant or there is a new strain of the virus, then how long we are going to be protected by this vaccine? It is a difficult question, and we may need a booster dose for that.
Can I just add one thing? For example, this Covishield, the time duration and gap, all that we've been talking about, the basic premise behind that was that because vaccines were lesser to begin with, the study that was done basically showed that, gap by even after giving the first dose, it gives about 76% efficacy. And by prolonging it to nearly 12 weeks, you are allowing more people to get the first dose. Also, the first dose is for creating immunity. The second one is a booster dose. So you're delaying the booster dose and maybe increasing a little bit of length of time that will give immunity for. So as Arup says, I think in a year's time, we'll be able to tell whether we'll need to be vaccinated once a year for this, like the influenza vaccine or not.
Sure. That's a $1 million question that is going to be answered by us in future. Next question goes to Susmita again. Is there any contraindication of taking the pneumococcal vaccine that we take in 2 parts and influenza vaccine that we take yearly?
No, there's no contraindication per se, but definitely the duration, what is said is after taking 3 weeks after your second dose of Covaxin, you can take your influenza and pneumococcal vaccines, but not together. You can't, it is best not to take the COVID vaccine and the influenza vaccine together. So at least 3 weeks after your second dose of COVID vaccine, you can take them. And as you know, we have always been taking in most patients, unless they are very sick, both pneumococcal and influenza can be taken on the same day on both the arms.
So during the period of take, just one question.
I just ask you, theoretically speaking, only live vaccine, this is what the pediatrician and what the theory is, the live vaccine, if you take once, there should be a gap of at least 28 days before you take another live vaccines.
That's
None
right.
of the vaccine that we are speaking of, the influenza, the pneumococcal, or the COVID vaccine, are live vaccine in that way.
That's
So
right.
theoretically speaking, there, if you take an influenza vaccine today, and the person wants to take a COVID vaccine, say after 14 days or 15 days, we cannot tell that it is not justified. Did you get it from literature or something like that?
This is at the moment
Yes.
recommendation is such.
Yes, CDC recommendation is at least 2 weeks should be there between these two vaccines.
Between the two vaccines, the influenza, pneumonia, and the COVID vaccines.
Influenza and
Pneumonia.
And pneumonia.
And COVID.
So if a person takes COVID, this is very important for us, because if a person takes COVID vaccine and come to us and ask her for an influenza vaccine, what is our recommendation? Should we wait for 15 days, or should we tell him complete the COVID vaccine second course, wait for 15 days and come?
After the second dose, 2 weeks, 2 to 3 weeks after the second dose, you can take the other.
So is it that from first dose up to the second dose and 15 days beyond the second dose, one should not take this?
15 days beyond the second dose.
From the, that is true, but the first dose, from the first dose to second dose, there is a gap also. During this period also, it cannot be taken. It should not be taken.
The recommendation is not to take. It is after the second dose.
So this is very important, and this message should go to all of us, that when advising for pneumococcal and influenza vaccine, in the interim period, if somebody takes the COVID vaccine, it should not overlap that way. At least it should be taken at least 2 weeks after the second dose of the corona vaccine.
That's right.
Thank you. Next question to Arup. Again, we have already discussed vaccination in pregnancy. What is the recommendation? Again, the same question.
Yes, well, briefly, I would mention there are two things, actually, effect of vaccine on pregnancy and effect of pregnancy on vaccination. So first, effect of pregnancy on vaccination is that pregnancy is sometimes thought to be a state where the immunity is lower because we are growing foreign proteins inside our body. So it has been postulated that the vaccines may not be effective during pregnancy, but it has been proved wrong. We know that influenza vaccines is as effective in pregnant women as in non-pregnant women. So pregnancy does not have any effect on vaccination. And now vaccination on pregnancy, as already told, COVID takes a toll on pregnant women also. And it can be given after discussion with the pregnant woman. In fact, in the Pfizer trial or in the Moderna trial, a few patients got pregnant in the AstraZeneca Oxford trial also, and they are following up those patients, and there is no any adverse event found. And for Pfizer and Moderna, we are also the animal studies. In animals, in pregnant animals, they have done the studies, and there is also no fetal abnormality and no problem in the pregnant animals has been found. For Oxford vaccine, we do not have a data on pregnant animal. So it can be given after discussion with the patient if the risk is too high, and it is individualized decision.
Better to avoid it.
So
individualized decision.
Epidemiologically, we should not give. If a pregnant woman comes us, we will.
Better to avoid it during pregnancy. That is the recommendation. Now, what about vaccination in children? Indranil.
So yes, it has also been discussed. Susmita has also given a bit idea of it. But yes, no vaccine can be widely given to children until it has been tested in them. This is the dictum. So if we see the current mRNA, this COVID-19 vaccine was not stipulated or approved in children younger than 16 years. So the Pfizer one, as Susmita told, but what I got from the literature is it is authorized for people above 16 years. The Covishield and the Covaxin are all above 18 years. So since the trials are not there, we cannot give. And vaccination in children in the two Indian vaccines above 18 years, this Pfizer mRNA vaccine above 16 years. That's the
Covaxin is above 12 years of age, and Covishield is above 18 years of age.
Covishield is 18. Covaxin, it has been given in different literatures, different ways. I don't know what the real picture is. As you are telling, it is 12. Okay, let us accept it.
This is on the Covaxin data sheet.
Pediatric trial has been started as for Pfizer, and I think also Covaxin. Now they are designing the pediatric trial, so we'll have the answer very soon.
Also, they are coming out. Bharat Biotech is trying to come out with a nasal vaccine. So I think that will be
the live vaccine one. So another important thing is that these pediatric people are somewhere resistant to or they are having less severe infection, only carrier. That's the another important thing that is to be taken into account. So in fact, the real purpose of vaccination in this pediatric age group is also not that required in that way, if you think in the other way also.
So the issue is this: the vaccination is adult. There is no doubt about it. But in children, the vaccination should be definitely about Covishield. It should be over 18 years of age, and it should not begin in Covaxin after 12 years of age. So that is the recommendation, I believe. Now, what about do these vaccines work against variants? Susmita, I again put this question to you. Do these vaccines work against variants?
So I think that's
It's a very, very difficult question to answer. I understand.
Yeah. So what has been seen in studies and in trials is that they have found to have immunogenicity. For example, Covishield has been found to have good immunogenicity against the British variant. So the variants are mutations of viruses which have been found in a certain country and have been given that name. For example, the British variant, the South African variant, the Brazil variant. And Covaxin seems to have efficacy against the South African variant, whereas Covishield has been shown to have very little immunogenicity against the South African variant. But whether they are efficacious or not, it's difficult to say because efficacy studies are not out yet for them. But in theory, the immunogenicity has been found against certain variants. But whether they are, as I said, efficacious or not, efficacy studies are not out.
So in general, the trial is going on, and the final word is not definitely.
Yes, but sir, in Johnson and Johnson vaccine developed by Janssen has been shown to be effective against this South African variant. Till now, the South African variant is the most infectious one, which is circulating in the world. So only the Johnson and Johnson vaccine, it has shown a 58% efficacy against the South African variant, and that has been highest till now.
Right. So there are debates definitely going on, and this is to continue till the trial is over, and about the variants, vaccination against the variants. And what is the recommendation of vaccination already who had COVID? It's a very important question. And Arup is the question put to Arup. What is the recommendation of vaccination already who had COVID? Because people ask, I've taken COVID vaccine. Why should I be vaccinated? And if somebody have already had COVID already, why I should be vaccinated?
Yes. At present in our country, we should take 2 full vaccines, or we should complete the dose even if you have COVID. This is the recommendation. But theoretically, for vaccination, we have 2 doses. First dose is called the priming dose, and the second dose is the booster dose. For those who are already infected with COVID, that acts as a priming dose. And if you add another, if you give the injection or vaccination, that will act as a booster dose. Theoretically, it is very sound that we can give 1 vaccine, or that will act as a booster for them who had already have COVID. But this is logistically very difficult to ascertain which patients had COVID, which patients have not. So that's why it has not been percolated among the general population, and we are vaccinating with 2 full doses even for COVID patients.
There's one issue is very clear, that a person, in fact, it has happened in life. The patient who suffered from COVID, theoretically suffered from COVID, RT-PCR was positive, they suffered from COVID. Now, when the patient has recovered, when is again being asked to take the vaccine, the patient is really questioning why I should take. This is the question. And definitely we say that we have no evidence that it will not recur in you. So you need to take the vaccine to protect yourself from any further COVID.
Just to boost the memory, his antibody will protect or persist longer, or T cell memory will persist longer.
Absolutely. So another issue, Arup, a person is given the first dose of vaccine, develops COVID after say 14 days. Then when should he take the second dose of vaccine?
Oh, I don't know. There is still
very important hypothetical question.
No, not a hypothetical question. This has been clearly stated by WHO.
Very important, very important.
So after the first dose, if a person develops COVID, the second dose can be taken after the quarantine period is over and after his turn comes, say after 28 days or as 4 to 6 weeks. So after the quarantine period is over, or he is symptom free, and then 14 days has gone, and his time has come, for example, he has covered these 4 weeks from the first dose, then he can take the second dose. In fact, there is no other restriction for that.
So what should be the answer, Arup?
As I told you, that after he has recovered from the quarantine period, say 14 days, or he has symptom free and then 14 days has gone, and his turn for the second dose has come, you will be taking the vaccine.
So a person after the quarantine period,
absolutely, whichever is later, whichever is later.
Right. Now the question goes to Susmita. The very common question that we come across: do you need to use mask or other precautions of social distancing, hand washing, sanitization after the COVID vaccination, the same way a person was doing before taking the COVID vaccination?
Yes. So the most we as doctors are accused, even let's leave aside COVID vaccine, even when we prescribed pneumococcal vaccine and influenza vaccine, unless you actually explain to the people who are getting the vaccine that a vaccine does not prevent you from having the disease, it only helps you from fighting the disease and reducing the severity of disease. Similarly, taking the COVID vaccine does not mean that it makes you immune to infection. Even after getting the COVID vaccine, you will be as you'll be, as it'll be as easy for you to get an infection as the second person who's not been vaccinated. But the only thing that the vaccine will do is fight the virus and reduce the severity of the virus on your body. Therefore, if you want to avoid infection A and B, not be a spreader, then you have to continue to mask up, maintain social distancing, and maintain hand hygiene, at least until herd immunity or nearly most people in the country have been vaccinated, because that way you will save not only your own family members, but a lot of other people around you.
Right. So this has to continue till we do not know how long this has to continue.
That's
because
right.
It depends on the social position. What is the herd immunity of the society about this COVID?
Unless again a new strength comes in.
Right. So this is something which is going to be for an indefinite period as of now, and we do not know when we will be off from this process that of keeping the social distancing and washing and
so it is a trouble for us. How long will we be using our mask in our clinic to see patients?
So it is a question to everybody, and of course to us also. Now the next question to Indranil, that people, we have already discussed about that how the vaccination is going on. Initially, it was given to the priority, it was prioritized to the medical and paramedical persons. And then it came to the aged person with comorbidities. And age-wise, then it is coming down, and then it is being taken. The people are confused. Suppose a middle-aged man, a middle-aged person, he doesn't know when to take it as far as governmental protocol and procedure is concerned. What is the process of this vaccination for a person who has no prioritized comorbidity or otherwise to have this vaccination? So please elaborate this so that the people, in fact, we also, as a doctor, we also must know that people usually ask us, you being a doctor, you have the access, you have taken your vaccination, but how we would take and what is the procedure that is to be followed? The very technical question that I'm going to ask you.
So the part of this has been answered by Arup. Rightly told that the healthcare worker and the healthcare staffs, they are the prioritized and they have been given the vaccination, which has already been done in a phased way. Next comes the frontline workers, which include the police and the army officials, which has already also been done. Now government is giving, in West Bengal at least, government is giving vaccination to those who will be going for the election duties. So the all people who will be going for the election duties, they are vaccinated. So now, along with this, vaccination for the aged are going on, those above 60, and those above 45 with comorbidities, which will come, a long list of comorbidities have been enlisted. Anyway, for people other than the healthcare workers and the frontline workers, which has already been registered to the chief medical officer's office or designated office, here, people who are above 60 and 45 with comorbidities, which are coming, they have to register on the CoWIN app, and they will be, after the registration is completed, they will receive an SMS once they put in this mobile number, and they will be updated on the time, the date, and the venue, and what kind of vaccination, whether the Covishield or the co-vaccination that they will be getting, and they will be carrying with their proof of identity, and there they will be vaccinated. That's finished. Coming to the list of comorbidities in patients who are above 45, less than 60, a long list, about say 20 list of comorbidities have been put in. Just to mention a few of them: heart failure with hospital admission, post-cardiac transplant, significant left ventricular systolic dysfunction less than 40, severe valvular heart disease. So I have also written them out: congenital heart disease with severe pulmonary arterial hypertension, coronary artery disease, angina and hypertension, diabetes. Coming to a respiratory part, absolutely those in the FEV1 less than 50 or hospital admission or more than 2 exacerbation in a year. That's the groups, the B and the D part, also the C part. So these are the patients, and many other, for example, bone marrow failure, sickle cell disease, primary immunodeficiency, patients with intellectual disabilities, muscular dystrophies, and a long list of them have been there. You can go through the list in the website and then vaccinate accordingly.
Yeah, I want to add a little thing here.
Sure.
Actually, government is promoting that you should not register through the app, CoWIN app. You should register through the portal, web portal.
That's the thing.
Because the app is not working finally for every time. And another thing, that if the patient does not access to these web services, he can go with the Aadhaar card to the center, especially the government center, if he's more than 60 years of age, and can be vaccinated there.
So another thing is that the government has also enlisted a lot of private hospitals which are entitled to give the vaccination. A list of this are displayed in the website also, and the maximum charge they will be taking is 250 rupees for each vaccination.
We have some more time to discuss, and one question I am putting myself to all the panelists. There is a question I put to Arup, that how long this vaccine is going to protect the illness. This was the question, and we said that Arup gave the answer. But is there any dose, any need of any further booster dose? And if it is so, then when it should be given? Because we do not know where the herd immunity of the society, what will be in future, and how long we are going to have this physical thing that we are maintaining. So we have some uncertainty about the future. So can you give some insight about the further dose of vaccine that might be possible, that it could be recommended in future, that because we do not know, because the second wave has come already and is definitely on the rise in many states. And in this perspective, is it advisable, or it should be thought of any further booster dose that is likely to come up? I would like this from Arup and other panelists. Is Susmita is there, or has she left?
Yes, she is there.
I'm here.
I would like to have recommendation from all of you.
So if there is no variant, suppose two situations, there is no other variant, and we have this whatever strain is circulating in our country, we have only this strain. So based on study which are available now, we can say that we may need a booster dose after 8 to 12 months, because we know that the protect immunity lasts for 8 to 12 months, 8 months according to the current literature. But if a variant is there, I don't know the answer. So we may need a separate vaccine with a separate mRNA or separate spike protein design very in near future. African variant, that is the most dreaded variant at present. In our country, we have 400 now, around 400 plus patient with this variant. But given the opportunity, this variant will rise in due course, and we don't know that whether we need a vaccine against these variants designed specifically against this variant in near future. Answer is still not very clear to all of us.
So just to take up from where you have stopped, definitely it is the vaccination way that we can build up the herd immunity among our community and stop the spread of the virus if no variant comes. But if we take the example of influenza vaccine, where if there is a mutation and there is, say, not only there is changes in the strain of the vaccination that is coming up, and vaccination is being given every yearly, probably here also if the strain is changing or newer strains are coming up, we have to vaccinate accordingly as per these strains that will be coming up. And vaccination is practically the only way that we can build up the herd immunity among the community in large.
Susmita?
Yeah, I have nothing more to add. From whatever information we have so far, that even with natural immunity, it has been shown to protect for at least 8 months or so in studies.
Right.
And so with the vaccines, I think it's only time that will tell us. Most likely it'll be once a year vaccine unless variants come in. But I think we'll leave it to time. At the moment, it's all conjecture.
So the issue is the variance is coming or not. That is the main issue. As of now, what is going on with this strain, perhaps 8 months or 1 year duration is quite good enough to have this protection. Then couple of questions have come.
So there is an important question, which practically I can see. People who are taking antiplatelet drugs, should they receive COVID vaccine or no? This has already been discussed. So it has been discussed that there is no contraindication for patients who are taking blood thinners, antiplatelet drugs. Only thing is that it's an intramuscular injection that is given. So the precautions to be taken while giving any other vaccination, that is while giving intramuscular vaccination, we should see whether hematoma or some other things happen or not. And the person should be kept under observation, but there is no contraindication for this.
चलो
Okay.
Vaibhav, mute karo khud ko.
One thing.
So one thing I want to add
questions
here.
Have come.
One thing I want.
Yes.
So
I
want to add here in this antiplatelet. Yeah. So the antiplatelet has already been shared that it has no contraindication. But if the patient is on anticoagulant, like he's on warfarin, then he must check this INR. If the INR is given, I think it's more than 2.5 or 3, then he should consult his doctor before taking the vaccination.
More than 2.
More than 2.
So
Yes, something.
Yes, that IM injection.
So
if the INR is more than 2.5, any IM injection will cause harm and hematoma will be produced after IM injection.
Yes.
1 second.
Yes.
But with Covaxin,
So for those patients,
the data sheet says if you're on anticoagulants, not for Covaxin. But the basic recommendation is, number 1 is, as you've said, antiplatelets, no contraindication. With warfarin or acetrom, INR must be checked less than 2 and check with your doctor. NOAX, there is no contraindication to take Covishield.
That's good. It's a very common question that is being asked, and we have to answer these things.
Similarly, take this question. Any person who are allergic, for example, asthma, food allergies, or any other allergy, they are also not a contraindication. Only thing
not
is
a contraindication that we have discussed already.
Observation. Yes.
A couple of questions have come. I am just putting it to you. One, his name is also Dhrubajyoti. I don't know, Dhrubajyoti Satyar. Is nasal vaccine really coming? His question. Arup?
Yes, it is being developed.
And what is the fate? What is the fate? What is going on? And
Bharat Biotech, who's developed Covaxin, is developing the nasal vaccine.
Once we had a live nasal influenza vaccine also, it has gone out of vogue. The live nasal influenza vaccine is still not now. But if it is a nasal vaccine, it should be a live vaccine. So there are different advantages, there are different disadvantages. Contraindication for the nasal vaccine should be also there, because as we have seen that the nasal influenza vaccine was contraindicated in patients who are asthmatic or something. I don't know, there are a lot of lists which will be coming for the nasal vaccination also. But yes, it is in the pipeline.
Right.
Oral vaccine is also in the pipeline, and This is in phase 1 trial now. And if you get an oral vaccine, then the mass vaccination will be very much easy for all of us.
Like polio.
Yeah.
Just one question has been put by one Dr. Bhanu Prakash. If antibody is not produced after post-vaccination, is there a need to take booster dose? His question is very specific. Suppose a person has undergone antibody test after the first dose and no antibody has been found. Should he need a booster dose?
Means he, after the first dose, antibody is not produced, he should second the second dose. That's
But
true.
when it has been done, he has not told. Suppose after 3 weeks.
Again, the question is, even after the second dose, if there is no antibody, then what should we do? Should we take another dose or not?
Right. I think the booster dose is a must. It has to be taken.
So yes. So, but the real question should come that even after the second dose.
Even after the second dose, if the antibody doesn't come, what
should be the recommendation? Should we take another booster dose or not? I don't know that answer.
There's no answer.
Yeah, can I take this question?
Please.
Yes. Actually, it is not always that you will have a humoral immunity to this. You have cellular immunity, you have innate immunity. There are many lines in the immunity. So first is innate, then cytotoxic T cell, then humoral. So you may not develop an antibody response to a vaccine also in some people, not in all. So if you develop a cytotoxic T cell immunity, that will protect you from future COVID. But we do not have any measure to we do not have any clinical methods to measure this cytotoxic T cell immunity actually. So that is a problem. You should go for vaccination, and there is no need to check whether you have developed immunity with antibody. I think this should be absolutely not favored actually.
We should not check. There is no need to check. But what is a theoretical question is that even if the antibody is not developed, is a booster recommended or not? Theoretically speaking, yes or no?
No, you have to complete the 2 vaccination schedule. You do not need any booster. Even after natural infection, you cannot have antibody. Natural infection is much more larger. You may
not have an antibody.
Replicating virus. Yeah. So you may have this phenomenon with vaccine also.
On an epidemiologic basis, checking antibodies is not feasible. So therefore, you have to take both and just leave it at that.
Couple of questions more have come also. One is asking Dr. Punnathotiya Vandya. He's asking what maximum time we have to observe for long-term side effects of vaccine. That is how much period one should observe after beyond which we say that there is no side effects to this vaccine. Is there any such guideline?
So,
okay.
Yes, Susmita, please, you take it because I've already told my person.
There's no such guidelines. The common side effects that are observed are pain at the site, and somebody can have, reeling of the head. The main thing that we are looking for is whether someone's having an acute reaction or anaphylaxis, for which 30 minutes post-vaccination is the guideline. Following which, rare side effects that we are going to look for, which is blood clotting, neurological symptoms or not, are very, 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 very rare. And there are no guidelines that you should watch for whether somebody is developing after so many days or not. So there are no such guidelines.
I think one guy has asked, what are the side effects of Covishield? We have discussed, so no need to repeat it. So, one guy has, Avinash Pabishetty, he has said that how much gap should we take to give the dose once the patient has recovered? So after recovery, which time the vaccine should be taken?
Indranil has already answered that question.
So just repeat once more. Yes.
It's 14 days to 1 month. That has been, in some guidelines it's 1 month, in some guidelines it's 14 days after recovery of symptoms.
One more question.
14 days.
So, yes, but another very important question: what is best, Covaxin or Covishield? The answer is there is no head-on trial with Covishield or Covaxin.
Right.
In terms of safety and practically efficacy, as already Arup has told, that efficacy is not that how it has been compared in each of them. So both are safe and both are good.
Yes, whatever you have, you just take it, and it will prevent the future severity of infection. And you should not go for choosing a vaccine now.
Absolutely.
This is not the time.
One very important question that they have asked is, After taking Covishield, can someone take any other vaccine? So two should never be mixed. If you've taken the first as Covishield, the second one is also recommended to be the same. Mixing and matching of vaccines is not right because they are two different mechanisms of coming into your body.
Right.
Okay, but to add to it, Susmita, just take a real life. I have taken the Covishield vaccine in the first day that has been given. I've completed it. So now in the near future, say after 3 or 4 months, the Pfizer mRNA vaccine is on the pipeline coming to India. And if I think of taking that vaccine, is it recommended or in any way, is it going to help me, or is there any contraindication for taking it?
There is no reason for you to mix and match a vaccine. You've created immunogenicity and you're boosting it. So by giving another vector or another method of coming in, you're not going to be boosting it, are you? You're just adding another vaccine onto it. It's like two different things.
So the bottom line is we should not take.
No.
Absolutely.
Right. Any other variant of vaccine we should not take in pipeline what is coming, right? Another question has come.
Not going to cause any harm to us in that way. If we are taking it, for example, I've completed my Covishield vaccine, but say after later on, if some other vaccine which has a proven better efficacy and say with a different mechanism of action or with a less toxicity comes in the pipeline, and I wish to take to have a better protection. See, anyway, it is not going to harm, but there is no recommendation, or as of time,
Yes.
It is not recommended as of time.
Unless there is a study, we cannot recommend
Absolutely.
this.
In fact, one question has come. I'm not going to read the details of the question. If a patient of asthma, for history, severe asthma for last 15 years, and he has been taken Covishield 1. When the first dose was taken, he had a hematoma at the site of injection, and after that he had some watery motions for a few days, and he has been asked to take Covishield a booster dose after 4 weeks, and his date of the booster dose is on 2nd April. Should the second vaccine should be taken? I think she should be taken. It is no.
So again, a hematoma has been produced, so he has to look for whether he was really taking some anticoagulant or not.
That is
should
true.
be looked at in that case.
But there is no such history. No such history. So
Yes,
he can take, I think.
So our Shubhasis has given a comment that people above 60 and those 45 to 60s with comorbidity can directly go to the center where without any prior registration. That is what the message should be going. That is without even they have not registered into the CoWIN app or CoWIN say website, they can directly go with their Aadhaar card or any proof of identity and directly register there and take the vaccination.
There some questions have come. One is saying that Dr. Ashish Kumar Da, in an article published in NEJM dated 16 March, 2 doses of COVID vaccine had no efficacy against the.
That is the Covishield one. The CHADOX is the Covishield.
The variant in prevention of mild to moderate COVID-19. Is it? I don't know how.
No, it is a comment that he has given. The Covishield has no efficacy against the B, means that I think the British variant in preventing mild to moderate COVID-19. I don't know it. B1.351 means the British variant probably.
Dr. Mini Garg also has said that she wants to know that explain regarding vaccination in patients on oral anticoagulants like rivaroxaban. I think oral anticoagulants, it should not come. The thing is this, that iron has to be sick.
Absolutely.
And nothing else.
Only newer anticoagulant, there's no contraindication for Covishield.
Right.
So now the problem is, Susmita, newer anticoagulants, do they really require to monitor the INR in that way?
No.
No, that's the thing. So newer anticoagulant, we do not monitor the INR. And in fact, before taking the Covishield, they need not do the INR. Only it is that for warfarin or some other the older anticoagulant. So Sampath Biswas's question has been taken care, that is there any role of vaccine in post-COVID people? Yes. People who have suffered from COVID, at least 4 weeks later on, they should be taking the vaccination. And they should complete the 2 doses of the vaccination.
And the same question has again come, whether there is any advantage of Covishield over Covaxin. And we, from this forum, will say it is almost same. So that way, you cannot differentiate. I believe all will agree with me. So it is a nice discussion that has gone.
Yes, Arup, there is a question. How many cases of anaphylaxis reported after Covishield? Do you have any literature review from India after the Covishield vaccine?
No.
Any anaphylactic reaction?
No, we do not have any
not
numbers.
seen.
We do not have any actually adverse effect reporting system well in place in our country, like
No,
the USA.
We do have the COVID.
But in USA, they have a very robust VARS system, by which we can upload your own data of side effects. I am not aware of in our country.
You have. If even after a vaccination, you will be getting a phone call with about your vaccination has been done or not, whether there is any adverse effect or serious adverse effect. In fact, it is the responsibility of the center where the vaccination is given to report all serious adverse event to the authorities. So, but I don't know.
Have you received any phone call? I have not received any phone call after vaccination.
I got a phone call.
I haven't received.
The thing is that I don't know what is the real data about Indian data about the cases of anaphylaxis or how many cases of anaphylaxis have been there after the Covishield. I don't know that.
But yeah, you can. I think you can report
one point I would like to mention.
Portal.
What complaint you have received? Is it that some allergic reaction has come up? Or is the anaphylaxis is a different condition, different state of allergy? So whether you have received that.
So that is not but I don't know whether what is the pool data. What is about the pool data? I didn't get any idea about what the pool data tells us about the allergic or anaphylactic reaction after the Covishield.
Right.
Unless it is published or it is
practically for our patient, we have not seen any anaphylaxis till now.
So, Arup, unless it has been put in some public domain or it has been published, how can we get that data? So it has to be published or has to
not have that
public domain so that we can have a view of it. So I have searched literature but didn't find that. If someone gets it, you can just tell or give your comment.
So we have discussed quite a few various aspects, an overview and various aspects of the vaccine, of the COVID vaccine, its efficacy, safety, its indications, contraindications, its likelihood, its side effects, and its effectivity, how long it persists, when it should be given again, and what are the other effects, and how it can be given with pneumococcal and influenza vaccine, and whether any mixing of strains can be given or not. So all these questions have been very elaborately discussed. So I think we can end the session because it is almost over.
Yes, before we conclude, I think one thing is there. So this is the fastest developed vaccine in the world. We have developed this vaccine in the 7 months, and previously mumps was the fastest developed. It was developed in 4 years in 1960s. So I think the scientists who have developed it, they actually deserve a big round of applause for all of us.
Definitely. So all thanks and all cheers to the scientists who have developed this vaccine so quickly, and thanks to them for the tremendous work, stupendous work they've done. So I believe that, do we have any other discussion or questions that we can do? I believe the time has already crossed 1 hour. Thank you for the panelists for participating in such a wonderful session. And thank you all. And thank you the participants also who have listened and put questions to encourage us to get answers from all of our panelists. And thank you very much. Thank you all again. Good evening. Thank you. Bye. Thank you.
So Dr. Rai, a word of thanks to the sponsor also.
Right. This program has been organized by the Indian Chess Society particularly for the East Zone people, and this has been sponsored by the Lupin Pharmaceutical. So thanks to them.
It's an unrestricted grant from Lupin.
Unrestricted grant from Lupin Pharmaceutical. So this is the thing without whom perhaps this program would not have been possible. And with all these words, I would like to conclude this session. And thanks to all the panelists for giving some wonderful answers to these questions and making this interactions, a very lively one. Thank you all. Thank you very much.
Thank you.
Thank
Good
you all.
night.